the Project ECHO, Long-Term Care Learning Action Network. It's good to see you all today. For attendance purposes, please enter your name into the chat box as our way of taking attendance. And if you have a smartphone, please also try to do this as well. As many of you know, we launched the ECHO LTSS COVID series from April to September of 2020 in response to the need for COVID training in Hawaii's senior care facilities to help prepare for the pandemic. And really, it's been quite a ride. Trying to implement many of the federal regulations and guidelines that keep on changing. And it looks like it's really just going to be more of a marathon than a sprint. So we thought that we would transform that series and take a new approach to support facilities as they implement and streamline all these processes. Next slide. So this is a collaboration. The Pacific Islands GWEP program at JAPSOM is partnering with the Healthcare Association of Hawaii. So Lori Henning, please wave. Thank you, because she's really helped a lot with some of the planning, and Mountain Pacific Quality Health. I know Mark and Maggie are on there. Please wave. Thank you very much. We are also using the Project ECHO model to provide education from quality improvement at leadership and implementation experts, and combine this with the opportunity for case presentation and discussion. That way, everybody has the opportunity to share experiences and practical ideas and learn from each other in a community of learning. So yes, all of you participating are also partners as we learn together, and your engagement and participation is critical to the success of this endeavor. Next slide. So we commit to maintain and safeguard the confidentiality of information shared. So all case presentations are required to be de-identified and HIPAA compliant. And in order to create a safe learning environment, we will foster a culture of mutual learning and encouragement rather than negatively shame or blame. We have a lot to learn from each other. ECHO Hawaii's case consultations do not create or otherwise establish provider-patient relationships between ECHO Hawaii specialists and participants and whose cases are being discussed in this ECHO setting. So that's just a little disclaimer. Next slide. This is the schedule. Ultimately, the goal is to have nursing homes that deliver superb care, right? And so we're going to start the series by learning and applying leadership, communication, and quality improvement tools that are focused on COVID challenges. Later on, that's months down the road, we will probably move this on to other CMS mandated focus areas, such as dementia behaviors, trauma-informed care, medication safety, falls, and things like that. Next slide. The goal, of course, is to help nursing homes deliver superb care. Everybody can always get better. And of course, the immediate need is that we want to get through this pandemic together. But more than that, we are looking at the longer range goals as well. And so these are some of those goals and objectives. Long range is that nursing homes become more knowledgeable and be able to apply leadership and COPI principles. That nursing homes would be more prepared in infection control and prevention activities, and hopefully demonstrated by the absence of citations from state surveys. And the goal to achieve IHI age-friendly health system goals, which is demonstrated by improving the star ratings and quality measures scores in key domains. And Mountain Pacific is going to be helping in assisting in data collection. We do not want to create extra burdens and data collection mandates for any of you. Next slide. So this CME activity is sponsored by the Hawaii Consortium of Continuing Medical Education, which is a joint venture between the Hawaii Medical Association and the John A. Burns School of Medicine at UH. The program is also approved by the National Association of Social Workers for One Social Work CEU. But as a reminder, you have to complete the evaluation form in order to receive any CME, CEs, or certificates of attendance. Evaluations can be found on our website under the Evaluations tab, and also it's going to be in the chat box as well. We also ask that you enter your full name and credentials of everyone in attendance in the chat box so that we can keep attendance. So as you know, all sponsors of CME are also required to execute a conflict of interest policy, and speakers are expected to disclose to the audience any real or apparent conflicts of interest. that may have a direct bearing on the subject matter for today's program. Okay, so just want to just do a little bit of introductions. So I know there's too many people to actually introduce one by one, but I know that I've introduced a couple of people. I see lots of familiar names and faces, and I just want to highlight, you know, this big crowd here. We have a ton of folks from HHSC, and you can all wave if you want. We actually have folks from Plaza, the VA, Oahu Care Facility, Mauna Lani, Aloha Nursing and Rehab, Manoa Cottage, Arcadia, Palolo, Ohana Pacific, Hiolani, Kula, Kukini. We have just so many people, including a whole bunch of hospice, actually I think all of the hospice organizations in Hawaii, as well as a bunch of home care organizations and some health plans, so and a bunch of others. So we just really appreciate all of you coming to share your knowledge and experiences. So today's topic, we are going to be talking about leadership through crisis over the next 3 months. And to jumpstart us today, we are grateful to have Tracy Wiltgen. So she's from the Mediation Center of the Pacific, and she's going to give us a brief overview of effective communication with staff and families. Afterwards, Susie Schulberg from Arcadia, you can wave as well, yeah. And so she's going to be sharing some of her experiences at Arcadia. And Darren Yoshimoto from Palolo Chinese Home is also willing to share. So we really appreciate that, their willingness to do that. And then we're going to open up for all of you to share your challenges and ideas, and we all brainstorm together. So just want to thank you for all of that. And with regards to conflicts of interest, Tracy Wiltgen works for a nonprofit organization as described, and she disclosed that she has no financial conflicts of interest. So without further ado, I am going to let Tracy take it away.
Thank you, Ida, I appreciate it. And I'm gonna have my PowerPoint pulled up, and I think I can go ahead and start. Okay. Awesome. So thank you for giving me the opportunity to be here. The effective communication is my favorite topic, and it is such a critical topic. Communication, as you all know, is a key quality of successful leadership. In particular, during a crisis, effective communication is absolutely critical. I know that's how we have been navigating and working through day-to-day challenges. So the first step, and nobody likes to hear this one, is you have to put yourself in charge of you and accept the responsibility that you're the person that needs to set the stage for effective communication, be communicating effectively, and constantly encourage it. So key step. So despite all your stresses and worries, it's important that you're engaging and being effective. And how do you do this? So one, it's providing a clear explanation of what your organization is doing to manage operations. You don't want people worrying, thinking about what's happening. And granted, in times like these, it can change every day. So you may need to have a regular update about what kind of changes are being implemented. And it's changes and how to manage operations to keep staff safe, residents safe, both physically and digitally in terms of data and the expected steps that will be taken because people have many questions, many concerns. So it's important to remember in these situations, while your organization has no control over the event, that doesn't dissipate the frustration of staff, residents, family members in the moment. And if you don't communicate and continue to communicate, and we'll talk about and effectively listen, they're going to continue to take their frustrations, not only talking amongst themselves, but out into the public. And that's how rumors get started and bad feelings get promoted. And that's what you particularly don't want to have happen. Now, why did that happen? I have no idea. Sorry. Okay. So the first thing after is to address the need. So what are the questions that people have? So you need to take the time, and of course with social distancing, that's not always easy. You may not be able to meet in person, and not everybody has the equipment or the setup for video conferencing. So even if it's by phone, or maybe some people are in person, some are on phone, and some are on video conference. I know that's one of the things we've adapted to, is not everybody has access. So figure out how they can have access to conversations, so you can find out what are their questions, what's burning in their minds, to make sure that you're addressing it. The things that you might think are important may not necessarily be important to the staff, the families that you're working with. And so that's the next thing, is you need to really, what we call, deeply understand. And how do you do that? So we have 4 key tools. We call it EARS. It's an easy way to remember it. It's to be empathetic, ask questions, reframe, and summarize. These may seem really easy, but people don't use these in general. And then when you're in a crisis and under a lot of stress, it's easy to throw a lot of these out. So sympathize and empathize. You want to share genuine empathy and connection, and demonstrate that you know what's at stake. So it can be something as simple as, this has been really scary for all of us. It's been really scary for me. It's okay to show your vulnerability and connect with people. You're worried about how you're going to maintain a safe workplace. You're really stressed about how you're going to manage everything during these difficult times, both at home and at work. So just by being an empathetic listener, just helps people's comfort level and stress level go down a little bit. And these steps are important because it will help them be more likely to listen to you, which of course is important. So if you start off with your message, they're not going to hear you, because they're only thinking about what they're concerned about. So in order to really get them talking and get information out, because remember, everybody's different. Some people are going to be blasting you with all their worries. Other people are going to sit back and they're not going to say a word. And so you need to provide opportunities to draw people out. So I call it asking powerful questions. And they can be across the board. And I usually like to start with bigger questions, and then you can move in with more focus. So it can be anything. What concerns do you have about the new process we're implementing? Which policies are you worried about? Forgive me for the typo. What ideas do you have to best support your mother? So maybe you're talking to a family member. What are your greatest concerns? And let people just bring them up. Don't be overwhelmed. And remember, a lot of concerns are going to overlap, and that helps people feel comfortable to know that people have shared concerns. You're not alone. Other people have the same issues. What additional steps were you thinking would be helpful? How do you see the situation? What is it about that idea that you believe will help your mother? So now that you're getting some ideas out, rather than going, well, that can't happen, there's no way we can do that, get a little more detail and clarification. Remember, they're going to appreciate that you're taking the time to really try and understand where they're coming from, to be empathetic, that you're not discounting their feelings. So all of that lays a foundation that they're going to be more likely to listen to you, because you may not have all the answers. Surprise, particularly nowadays. You may not be able to implement all their ideas, or they may not be practical. But if you lay this foundation, they're going to be more likely to be open to you when you are sharing what's going to happen, what things you can and cannot do, what the future plans are. So can you help me see how that would work? What would be a safe environment? What would that look like to you? In what ways is that important? What concerns you most about that idea? What is your understanding about how that would work? So be thinking about powerful questions that's going to get more information out to really help you understand where people are coming from, and it's going to be a little bit easier to address their concerns, and also they're going to be more willing to listen to you when you're ready to share your piece. When they share information after you ask their powerful questions, you want to summarize and repeat back. A lot of people hear about effective communication, it's rephrasing. It's not saying back exactly what they said. Particularly when people are under a lot of stress, they're going to wonder why you're saying back exactly what they said. What you want to do is reflect back the key pieces, the important things that you heard, or the things that you think your impression is most important to them. That's what you want to be reflecting back. So you don't have to spew back a bunch of information, but summarize back the succinct points. And when you do so, do it tentatively. So I never reflect back, so this is what you want, and then just lay it out. I'll say, well, you know, I'm hearing that, or it sounds like what's really important to you or what your concerns are. And then I say them back, and then I'll say, is that correct? Why it's important is gives them the opportunity to make changes. It really tells them that you're trying to get what's important to them, as opposed to, I'm just trying to get my message across to you and move on. And so it may seem a little weird, particularly when you're at a decision maker level, to come across as tentative, but it's really helpful, particularly when people are stressed out, emotional, and not rational. And it helps them refocus. When you are talking to them and starting to share your message, it's important to what I call reframe or soften your language. You're focusing on traits, not qualities. You're not evaluating or judging, and that's really important. No matter what idea or what they express or how it comes across, you never want to come across that you are judging them, that you're not being empathetic. That doesn't mean you're agreeing with what they're saying, so that they trust you. And you're going to be specific, and you work from I statements. So here's some examples. I'm hearing you don't feel supported, and I want to understand what else we can do to address that. So that language, the way it comes across, it's non-threatening to the person you're talking to, or the people you're talking to. Tell me what ideas you have that would help to make you feel more comfortable. So then you can add to it. So it gets them, it sets a stage for them to listen to you. So that tentative, summarizing back, checking in, using I statements, trying to reflect back what you think you're hearing and their feelings, but never telling them what they feel. People will just take a step back and you'll lose their trust. Speak to be understood. And so this goes with these tools of reframing, softening your language, summarizing tentatively. You want to use non-threatening language, never be defensive. You may feel like you have all the weight of the world on your shoulders right now, but you also are trying to instill trust so that everyone works together. So you really have to be thinking carefully about your language when you share your perspective. And I often will caveat it as, this is my perspective, this is how I see it, here's the information I'm basing it on, but there's a lot that I don't know, and here's why I'm coming to these ideas. Be apologetic when you're under these types of constraints. I'm sorry I came across as if I was too busy to listen to your concerns the last time we met. I'm sorry if I seem really rushed in the meeting. I really want to hear what's important to everybody so we can work together on that. So it's important that you recognize we all are under a lot of pressure, and acknowledge it, apologize, and then keep moving forward. And let them know that you really want to understand their issues and address them, and be sincere about it, because you'll need to be thinking about ways that they can be addressed. Really important, provide continuous communication and regularly update information. I can't emphasize this enough. I know for us at the Mediation Center of the Pacific, when we all had to immediately work remotely and we had hundreds of clients that we were still attempting to serve, suddenly everybody's in their own silo. So we immediately set up, and we're fortunate, I recognize, we immediately set up a staff meeting, a quick one every single morning via Teams, which is a video conference platform that enabled us to touch bases on who's working with which client, what's happening with that client, who needs support. And we've continued to do that every day because every day changes, and we never had daily meetings before. I will reinforce that. And in some ways it's time consuming, but just some days it's a 5-minute touch base, just so everybody knows we're all in this together. And if anybody's going through a hard time, they feel supported just by the fact that we're reaching out saying what's going on. And then based on that, we know who needs some extra support, and then we'll reach out to them individually. And of course, the facts and the information in the world are changing every day, and so we need to be responsive to that. Provide an update on facts, things you know that you're doing, things that are impacting you. And you can also talk about things you hope to be working on or might be working on, even though it may change, and you can let them know that. Sometimes I think this is the way it's going to go and I'm reaching out, but it may not happen, and I'm going to let you know if we're not able to implement this new policy or this new action or this resource that I'm trying to obtain to help us. I'm really hoping it's going to happen, but if it doesn't, I'm going to let you know one way or the other as quickly as possible. And again, continue to check in that you understand that it's frustrating for them, that it's scary, that it's difficult, and you appreciate them continuing to work on these things, just like you are. Finally, remember, communication is a lot more than words. That's why I'm grateful for video conference. A lot of people say it's not the same as face-to-face. No, it's not, but as you get comfortable with it, you can see how people are reacting, and they can see how you're responding. So when it comes to a crisis in particular, it's not just about how you say it, it's the combination of what you say, how you say it, and of course the action that follows that will determine how people respond. You can lose their trust. So you need to be honest, you need to be continuously communicating, and you need to be continuously deeply listening to them, because they're going to be changing on a daily basis. Be patient, be supportive, show that you care, always speak with compassion and respect, and that will keep them trusting you and listening to you, which is really what you need so that you can have these important conversations, you can make important decisions, you can make changes as they're needed, and be able to sit down and have difficult conversations, whether it's with a group, whether it's on the phone, whether it's in person, whether it's video conference. So I was asked to keep it short and sweet because I know the most important part is the discussion that's now going to follow. So I'm going to let you close my PowerPoint because I don't think I have the ability to do so.
Okay, great. And as much as you can, because it's a discussion, if you guys can also, you know, put your video on so we can have faces to talk to as well, that would be great. If you haven't already typed your name in the chat box for attendance, that would be really great. Please do so. Okay, so so Susie, I think, is going to be up next, right? Susie Schulberg, and she'll share a little bit about her experiences. And then after that, Darren. But as our folks are sharing, I mean, feel free to type in the chat box, and you know, and we'll try to have a good discussion. Okay, go ahead, Susie. Thank you.
Hi, everyone. Thank you, Dr. Wen. Thank you. Great presentation. I just kept saying yes, 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 because you were going through all of your slides. A lot of great points. One thing that I just wanted to say when Tracy, what spoke to me is when you said, you know, a lot of us have the weight of the world on our shoulders right now, but we still need to instill confidence in our residents, our families, our staff, our clients, and our members. And the one thing that I think our organization is starting to see right now is just the fatigue that's starting to kick in. We do have a couple of outbreaks within one of our buildings, and you can just feel the tension. And so trying to work our way through that I personally am sick of hearing people say it's a marathon, not a sprint. It's like, I know it's a marathon, stop telling me that. But one big thing is the self-care. And it's not so much the frontline staff, it's really the managers that we're starting to see the fatigue set in. So we're really trying to focus on that. In terms of communication, one of our hallmarks for our organization is communication. We'd rather over communicate than under communicate. And what I wanted to share is just kind of the buckets that we've been doing when we look at residents, clients, and members. The Arcadia family serves about 900, a little over 900 Kupuna each day. We employ about 550 to 570 employees at any one time. We have 2 life plan communities, Arcadia and 15 Craigside. And then we also have a home care and home health agency, an adult daycare program, adult day health program, and our Arcadia at Home program. So with our residents, clients, and members, communication has been key. Kind of lessons learned. We had a lot of written communication in the beginning, and me being the wordy person I am, lesson learned, residents like bullets, families like bullets, so keeping it very short and to the point, but being a step ahead, knowing that when you're going to do something, the communication piece should be following immediately. For our social workers in our long-term care area, making sure that they're up to date. These families can't come in, they can't visit. The social worker is the lifeline. And so being on top of that before the families start calling. That was one big thing. For our independent living and our assisted living residents, again, having those digestible bullets so that they're not reading through 3 pages of prose. We just want them to know this is how it's going to affect you, because sorry to say, our residents are all about themselves. So they want to make sure that they're in the know. We do in both of our communities utilizing the residents themselves to help us get the words out. We have an advisory boards at both Arcadia and Craigside. So really getting the residents to be advocates and helping them to calm the fears within our communities, because a lot of times they just hype each other up, and the Coconut Wireless is alive and well. So making sure that residents are communicated with effectively, and then they can help to spread the word. A couple of new things that we tried and have become successful for our organization is we do have a silver lining newsletter that we started at the beginning of COVID back in March. It goes out every week, and our marketing department does a great job, but it really shares and puts light on the good things that are happening amongst the really crummy time. And so it's really given a lot of boost to our clients, members, and residents, but also our staff too. We also started a YouTube channel, and so it was at one point weekly videos that were going out, because sometimes staff and people don't read, they want to see and watch. So it was, 3 to 4 minute videos that we would just update on what's going on. Another thing was just honestly transparency and press releases and getting them out, not hiding the fact that we have COVID in our building. It is what it is. Everyone's going to get it. So putting it out to the press and just going with it. And then just being visible, making sure that we are present. We don't have a lot of face-to-face interaction with our residents that much anymore on the independent and assisted living side like we used to. But again, just trying to be present and being there to answer questions. With respect to our staff, like many of your staff, they're resilient during this time, and they've done and continue to do a great job. Of course, Teams, and glad Tracy brought that up, we're a huge user of Teams. So not only have we used that for our management teams and our interdisciplinary teams, but also for our home care and home health staff. All of our CNAs and our nurse aides have Teams on their phones, and we have bi-weekly meetings every 2 weeks, or if something's going on, they have weekly meetings. We also have one challenge that we are having is because so much information is coming out so rapidly, and especially when we have an outbreak. We had our first positive resident in our nursing home level at Arcadia about a week and a half ago, and so much is going through. Communication was hard, so we're trying to figure out ways to communicate to all 3 shifts in an effective way. In person is the best, but it's a lot. It takes time. How can we effectively do that? Is it shorter huddles that we have? So just working through that. And then, for us, the most important is just being there to make sure that we support our team and give recognition, and just knowing the letting the staff know that we're there for them. Our testing policies and, you know, the mitigation once we have a positive or even trying to prevent it from coming in, just making sure the staff know what that looks like and that they're in the loop and they're part of the solution as we move forward. So those are just some of the small examples. I hope that is helpful, Dr. Wen. But yeah, that's it.
Anybody have comments or questions? Okay, so I'm gonna let Darren Yoshimoto share a little bit as well, and then we can grill both of them. No, it's not grilling. It's really just finding out some more details.
Yeah, no, Tracy, great presentation. Same thing. I mean, everything you said was so spot on. Not much more to add than what Susie and Tracy already talked about. I think communication really got tested during this time. I think we, look at what happens when we can't have visitors, when families aren't in contact, and then how important I think it really showed how important, family support is when it comes to the day-to-day life of residents in the community. So, I mean, for us, communication, I mean, it's the key, it's the insight to the facility and how residents are doing at this time for families being that they can't visit. It's how we keep our staff safe. It's how we keep the facility safe as far as all the different types of information. So from a communication standpoint, I think one is making sure that we understand that we have to, during this time, just overly communicate. And that, families and friends and loved ones and whatnot are depending on us to keep them updated on how things are going, and not just updated on how they're doing, but updated in a very stressful, trying time. Is the facility safe? Is my loved one at risk of getting sick? And so one thing we focused on is really working with our staff to let them know that this is a different time. And like Tracy said, we have to be patient. We have to be understanding if these families are going to call multiple times a day, several times a week, and that we be empathetic and understand that, they're coming from a place now that they can't have contact. And like you said, try and put ourselves in their perspective. I know everyone's doing, the telehealth and not telehealth, but the teleconferences and video conferencing, and I think that's great. But I think we found out what works well for us too is just all of the informal conversations and phone calls to keep families updated. We really focused on working with our staff. So I know a lot of places have it, cell phones for the nurses and whatnot. And we gave out all of the nursing station numbers and cell phone numbers. And we just told our staff that, let them call. And just, I know it takes time. I know sometimes it takes time out of a busy shift, but again, if we can be patient and address the families, then it's better for everyone. And it's better than issues pop up down the road and then families are getting frustrated. And so it's really educating them on being mindful of answering phones, taking the time to answer the phones. And it's really a good thing. And they're doing a good thing by doing that. And just being transparent. And I think one thing that, I look at our industry and healthcare in the state of Hawaii, I think we've been very transparent with each other. Like Susie was saying, I mean, COVID is hitting everybody. It's nothing to shy away from. And we know, and it's things that are not necessarily all in our control. But I think if we're transparent about resident cases or staff cases, and that's what families, the public wants to hear. They don't, it's about, okay, we have this situation, and then, Tracy, like you said, get our facts together, get a plan together, and then just overly communicate, this is what we're going to do, and be able to instill confidence in everyone that we have a handle of what's going on, and we will do our best. And it's instilling trust in them that the facility isn't hiding anything, because it's human nature, right? When something goes wrong, then people always worry about, they don't want to say this because they don't want to implicate themselves or things like that. And I think in a time like this, it is out there, we deal with it, we're open, we communicate, we address questions, and we just all move forward together. And so just keeping things just really simple. And I think a big part of it is also just talking to people at a personal level. So instead of worrying about trying to be so politically correct or professional, just a layman conversation, you know, talk person to person. This is where we're at. This is what we're doing. And I can't stress enough, Tracy, of overly ensuring that families or whoever you're talking to, loved ones, even our residents, our staff, understand, making them understand that we truly understand what they're saying. And a lot of times people just want to be heard and understood, and get their point across, vent, express their stressful situations. And I think all of us, once we feel that we're heard, we're not dismissed, and then there's timely follow-up, phone call follow-ups, returning phone calls, getting back to people, sticking to your word, and just those basic things. And we found that, you know, that's been really effective for us. And it's really, you find out that when you have a lot of communication with the people that we work with, especially the families and loved ones, overall, I mean, they've just been so supportive, understanding, and just for us, it's meeting them halfway and holding up our end of the deal, and keeping them informed of what's going on. So it's just day in and day out, just being genuine with them. So anyway, yeah, thank you guys.
Yeah, no, great. We have a comment in the box from Connie, Connie Perry. Darren, I work with a number of care homes, and even before COVID, they have often been terrible about picking up calls or returning them, which is frustrating as a professional, let alone if you're worried about a family member. It's very important. Yeah, so thank you for highlighting that fact that, gosh, you know, let's give out all your cell phones, let them call, right?
Their work cell phones.
Yeah, right. I mean, yeah, not the personal ones, right? We
Yeah.
have to go home at some point and not burn out. Yeah. Other comments? Other questions? I
Hi,
have a
this is Shelley Somerville with HMSA.
yes.
I think one of the things that I've had to learn to be okay with is that my service coordinators, we sort of thought, oh, they're going to have more time since everything is telephonic. But what we have found is that when they talk to a member or someone at one of the care homes or even at a facility, that they're on the phone a lot longer than normal, because they may be the only interaction that these people have had in sometimes a week or two, right? Aside from someone with groceries or something. So those calls are taking longer and longer, and I've had to adjust my expectations, right? And know that talk story is important. And Donna Lay, my cohort, has helped me with that, right? Is adjusting my expectations to say, sometimes that talk story is all they have. We have to be okay with them, with our people who work for us taking longer to get things done.
I think that's a good point. I mean, we found that out too throughout the past few months is, you know, with these video conferencing and whatnot, we set up schedules and these time frames, but then we found out that, I mean, it's so hard to like end that phone call because it's, you know, we got to move on to the next one and whatnot. And so having all of more devices and sometimes families, you know, their the technology is not up to speed. And so like we recently just installed several more phone lines. So we would have more cordless phones available in our facility. So we had more phones to be able to go out to the residents at one time. And so residents and the families can, you know, even their conversations just talk, you know, without a time limit. And so it's just continuing to realize how much we depend on communication and interaction, and just being able to continue to build the resources to be able to handle more and more volume for longer periods of time. Yeah, we found that's the same thing.
So one of the interesting things that we found, not so much on the nursing home level, I echo everything Darren says with our assisted living and our nursing home level, but an interesting thing that we found specifically at Arcadia is that we have groups of residents that are just socialites, you know, social butterflies, and they like to come down. They weren't wearing their masks, they weren't physical distancing, they weren't doing any of that, and so we really had to work with them. And in light of, in addition to having that positive resident in our nursing home level, we also have an independent resident who was positive, who made us, we had, in light of that, we had to isolate one of our floors. And so really we encourage folks, you know, we're basically, you know, you need to stay home, stay in your apartment. And that then, for these social butterflies down in our lobby, they can't do that anymore. So they found Zoom, and they have these Zoom calls, you know, within our building. And it's kind of cool. It's kind of quirky, but I mean, they're totally on it. And I hope it kind of continues, because I don't know, just a neat thing that wasn't necessarily us dropping the hammer and saying, you got to do this, but them getting creative. So that was nice. And, you know, that shows their resilience.
I found an app called House Party that lots of different people, so whenever you're on, it notifies other people that you're on, and so that they can get on, so you don't have to schedule ahead of time. It just sort of like beeps your phone.
It's called House Party?
It's called House Party. So yeah, and it actually has like games and things on it. So like I use it when I want to play a game with my friends, right? So that might be an option, is us to look at that and see if that might be useful for your members, for your patients.
Wow, sounds cool. Okay, so any other questions or comments? I hear an echo.
Shelly and I, like she said earlier, you know, we're cohorts, and we're actually joined at the hip, because he's a senior manager for the neighbor islands and I'm the senior manager for Oahu. But, you know, most of us on this call have never, ever lived through something like this. However, you know, that's why we're all on the same page, that things change every day. One of our medical directors, and I quote him all the time, is like, what we learn today, we may have to unlearn tomorrow. You know, so being able to keep our family, friends, coworkers, people in our community all motivated, and you know, we're going to get through this together. We cheer each other on. But what I want to say is, and I want to thank all of you on this line. You know, Shelly and I have been on the MedQuest meetings on the COVID task force. And I want to say that the silver lining is that there's no competition here. We're all in this together. I think that we have learned a lot about humanity once again, because it slowed us all down, and that we have to remember what's really important. And what's really important is what you all said, you know, is communication, building that relationship, being kind, you know, saying things nicely, because, you know, this virus does not discriminate. It could be any one of us at any time. And I think that, thank you everyone. Thank you Hawaii, because we're all one family, for taking care of each other and sharing. Because a lot of times, you know, with the competitiveness that we all have in our businesses and our homes and our health plans and all that, we push all of that aside in order to meet the needs of our family and our friends and our community, because we are Hawaii. That's my speech.
Thank you. Okay. Okay, so I have another question. I was wondering, so how do we control the coconut wireless? You know, do you tell your staff what to say, or how do you get them to give positive messages, or what do you do? Just question.
I think, I don't know, for us, Dr. Wen, I think what we do is we just be open, honest, and transparent. We just tell them like it is. We don't sugarcoat things. We're very matter of fact, but we're empathetic and we're compassionate and we listen. And so, you know, I think never do we tell them what to say. We tell them what the message is, but how they position it, you know, that's up to them. They have to own it and be able to feel comfortable saying things. But it's just being transparent, trying to be as on point and on time and timely with that communication. And it's a challenge. It's a challenge when you have a number of staff that you need to get to. But for us, it's the transparency and making sure that we're a step ahead so that we're not caught off guard, and therefore the staff's not caught off guard.
And I was going to share, by having effective continual communication that everybody knows that it's in place, it's going to be less likely that people need to go out through the coconut wireless or at least share misinformation. So when people know that there is a communication plan in place and you are taking the time to hear and address their concerns and issues, they're going to rely on the internal communication as opposed to going outside. And so that's part of why no matter what kind of day you're having, you still need to focus on all those good communication skills and making sure that it's solidly in place and reflected and modeled for everyone.
Yeah, I agree with all of that. And like Susie said, you know, transparency is the best, because if we can just be transparent and get ahead of the coconut wireless before it gets out there, like, oh, I already heard that. You know, best case scenario. And I think also just being open and honest, it leaves less for interpretation. And so when you have that, you know, people can't confabulate or misinterpret information going out. It's just out there. Well, this is what I heard. They're open and honest. I mean, there's no other way, you know, around the situation, or this is what's going on. And I think that's one way that we can mitigate the coconut wireless.
Yeah, you know, it's no secret HMSA had a big outbreak at our neighborhood center on Oahu. Yeah, it was in the news, but it was also, we didn't keep it secret. The minute they found out, Dr. Mugiishi sent out an email, said, hey, this is what's happening. You guys need to stay home. Anybody who's been here needs, it was company-wide, right? And then we got updates as other people. There was no secrets to it. It was, this is what's happening, so that the people around us could trust him and trust us and what we're saying. There was no, oh, what did this happen? If there was a cleaning schedule, we shared what it was, and we did our own contact tracing, yeah? So I think that opening, I mean, just like any of the nursing facilities that have gotten it, it's going to happen. It's like getting lice at a nursing facility. It's going to happen, right? I've been a director of nursing, right? We're going to get those issues, and COVID was going to happen. All we could do is mitigate it, yeah? And share that information. So, and I think that Hawaii has been excellent at not keeping this stuff secret and just being open and honest. It's happening. So yeah, just be out there.
Yeah, so that brings up another question I had. It's about feeling embarrassed. I would think that the person who was the index case, you know, would feel very embarrassed. What do you do to head that one off? Because and avoid the shame and the blame thing.
For us, we just overly emphasize that it could be anybody, you know, and all of us just have to be mindful of the decisions we make. It's bigger than just, for us, we say it's bigger than Palolo Chinese Home. I mean, this is a state, community, families, loved ones. And so if it is that one person or whatnot, it could happen to anybody. And so we never looked at it, and our teams and our staff have been so positive in pulling together that, I mean, we've had our employee cases, and there was never like blame put, you know. I mean, there was support. We kept in communication with that person. We did our own contact tracing. Our staff didn't, I mean, they really didn't put blame on each other. And I think it's just about making sure that you have that mentality of your organization and your community, that it's not a blame game. If it happens, we deal with it together as a team. We all come together as a team. It is, you know, it happened, it is what it is, and it's just about how do we mitigate it. And we never mention like staff names in any sort of like negative light, or they shouldn't have done that, or, you know, why did they make, we don't question it. Okay, it happened, they're going through enough already, and there's nothing more for us to do but figure out how to move forward, and that's the focus. And then when we get through it, it's just positive thank you everyone for doing their part and stopping, you know, any further potential spread.
Yeah, so Connie has a good question. I think that not being able to share who is infected made the anxiety bigger in your experience. And then there's the balancing question here. It's important to keep the positive person's identity private for respect and non-judgment, but the coconut virus is too strong. So I'm curious if Connie, wouldn't mind sharing your experience about what happens if you try to keep it private? Oh, Connie, we can't hear you. Are you speaking? Uh-oh, I guess we don't have, you're mute. Hmm. No, I guess you'll type. No, sorry. Right, maybe you could try to work on that a little bit. Okay, when we had to tell people, they wondered if they ate lunch with them. Mm, yeah. So, Jacqueline Mock, do you want to share your experience? Yeah. When contact tracing comes into place, those people will know. If it was a patient, they wondered if they had been around the infected person. Yeah.
Well, and I think Dr. Webb, this is Susie, I think the Coconut Wireless is alive and well. The staff figure out who it is. I mean, from our experience, recently, specifically, or at Arcadia and Craigside, we had a nurse in both buildings who tested positive, and the nursing staff immediately knows. I mean, it's alive and well. What we are trying to deal with is, in our challenge, not so much with communication, but it's the responsibility of knowing that when you go through a wellness screening process before you come into the building or before you go to a shift, it's very important to make sure that you are honest on that wellness screening form, because I will tell everyone on the call that the two nurses that basically brought it into the building, they had symptoms before they came to work. And it's like, oh, no, 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 I'm a nurse. I'm fine. I'm fine. Like, you're not fine. And that then at Arcadia resulted in a staff member contracting it and a resident contracting it. So, and then the staff will look to us of, what, are you just going to slap them on the hand, or is there going to be disciplinary action for this? So, kind of all eyes are on us and how we handle this moving forward. Yes, in a privacy way, but also a compassionate way. But they want them to be held accountable, because look at all that's gone through over the past 3 weeks in one of our communities with a nurse coming to work symptomatic 2 days before she said, I'm not feeling well. So, my point to that was the Coconut Wireless, they already know half the time, but we really try to stress the privacy piece. But that wellness screening form really is the difference between a life lost and a life saved. So that's what we're kind of seeing.
Okay. Any other comments about?
I wonder how people are handling it. How are those nurses emotionally? Yes, they did something, and we don't know their motivation, but so then people have died as a result of their actions. And what does that mean for how they are emotionally? Because it would be devastating to me to know that I caused the death of someone, right?
Yeah, yeah.
So what do we do for them? In addition to the fact that you've got other staff saying, what are you going to do to punish them? But is it really about punishment? It's about education, and how do we educate the rest of the staff that it's about that there has to be some empathy for what these people went through. We don't know why they went to work when they were sick. We don't know what their own circumstances were. But on top of that, now, day in, day out, they have to live with knowing that what they did killed someone.
And I think part of that, absolutely, and part of that is that self-reflection piece and walking them through that. And with the nurse at one of our communities, we went through that experience with her, and it was very positive. I mean, she understood that. She finally said, I know that what I did was wrong, and we worked through it. And she's back to work, and things are going well. So I think it's exactly what you're saying. How do you manage that so that you don't just, go right at them, but you want we want to continue to have positive for everybody moving forward because it's not easy. And you know, the one, I'm just going to tell you guys, the one here at Arcadia, the one staff member who did contract it is in the hospital now. And I don't even know if that nurse knows that this individual is in the hospital, but it's heavy on your heart. And so, you know, we're working through it. I don't have the answers, but, you know, I love hearing everyone's feedback on what we can take into consideration. So thank you.
You know, Susan, I'm glad you brought that point up because, I mean, that's just not Arcadia family of companies. I guarantee it's every single facility is going through that same screening process, and are the staff being open and honest in the screening? And then how do we handle it? It's not just you guys, it's all of us. I mean, that's a great topic for discussion, is how do we work through it? I mean, we emphasize it all the time on trying to be open and honest on the screening questions, but we know, I mean, staff, no one likes to admit they're sick. No one wants to take the risk of, oh no, I have symptoms, so I can't work. And then be sent home. And I mean, the financial aspect is huge, especially for positions that may be at a little bit lower compensation. So I thank you for bringing that up. I guarantee that that's something that every single one of us are going to be facing and working through. Yeah, good point.
No, thank you so much for being so open and honest about all of this. I think it really highlights the need for that honest communication and compassionate communication, especially since, of course, as Jacqueline points out, you can be asymptomatic and come to work and nobody really knows where it comes from. So we really appreciate that. So yeah, we're lots of more questions that I have, but I see that it's actually 2:57, so we do have to wrap it up. So just a reminder, if you want your CMEs, please click on the link, and I think Michaela put that in the link just a couple of posts ago on the chat. And if any of your friends and colleagues at your facilities missed this, these sessions are recorded, so you can certainly let them know. Go onto our website and they can listen to this recording as well. But unfortunately, we can't offer CMEs for the recorded sessions. Next month, we're going to have speakers from Mountain Pacific to talk about team building, so the team doesn't like melt away and disappear on you when it comes time for a crisis. So I'm hoping that's going to be a good discussion as well. And, you know, having more of your friends come and join us would be really good. So I hope this puts a lot of food for thought. And, you know, you'll be able to reach out to each other even offline. To gain further sharing and experience. The slides from Tracy's presentation will be posted on our website. So yes. Okay, thank you everyone for joining. We really appreciate it.
Thank you.
Yeah.
Thank you for coordinating. This is a great series. Thanks, Dr. Wen.
Thank you, Dr. Wen. Thank you, Tracy. Thank you, Darren.
Yeah, thanks, Susie. Thanks, guys. Bye.
Bye.
Thank you. Bye.
Thank you. Bye-bye.